Good afternoon, everybody, and welcome to Montclair's Spring 2025 Virtual Graduate Open House. Before we begin the presentation, we ask that you mute or turn off your microphone and utilize the chat function to ask questions. Our presenter today will be answering questions you may have during the Q&A portion at the end of the presentation. Please utilize the chat function to ask your questions at that time. Please be aware that this information session is for the online Master of Science in Nursing degree program, which is for licensed registered nurses in the state of New Jersey who wish to obtain an MSN. If you are a non-nursing college graduate looking to enter the nursing profession, please attend the information session for the pre-licensure MSN later today at 4 p.m. A registration link to that information session will be provided in the chat. If you are looking for detailed information on financial aid options available to graduate students in Montclair, please consider attending the financial aid information session later today at 5 p.m. A registration link to that session has also been provided in the chat. With all of that out of the way, thank you for joining us today to learn more about the online Master of Science in Nursing degree program. Our presenter today is Dr. Joan Vallis, Post-Licensure Program Director and Professor.
Good afternoon, everybody. I guess I'll start out and just ask you, are you all registered nurses? You can unmute for that. Do you have an RN? Yes or no? Jamila, you're unmuted. You can answer? No. Cedra, are you a registered nurse? I guess I can't hear. And Mohammed, are you a registered nurse? Christopher, I don't think they're hearing me.
I'm confirming that I can hear you, Dr. Vallis.
Okay, so they're not answering. Jamila, just put Jamila on mute again then. Okay, next slide. Okay, so this is an overview of what our School of Nursing has. We have a 4-year BSN program. We have an online RN to BSN program. And the one that we're talking about today is this one, the online MSN post-licensure, meaning that you are already a nurse in the state of New Jersey or eligible to become, get a license in the state from whatever state you're practicing in. Then we have an RN to MSN Bridge. The one that was explained to you, if you are not a nurse, is the MSN pre-licensure. If you have a bachelor's degree or further in a non-nursing field, you can take this program and become a registered licensed nurse. And that presentation is at 4 o'clock. The link to that is in the chat. Next slide, please. Okay, so this is an overview of the program. It's 35 credits. We have 2 concentrations, which we'll talk about briefly. It's designed for you who is the working professional. The study is part-time, and you can get out in 2 to 3 years. The didactic courses are offered asynchronously in an online format throughout the whole year. Next slide, please. Okay. All right, this is one of the concentrations. This is the nursing administration overview. This is somebody who wants to become a nurse manager, a nurse director, a nurse executive. It really builds on your experience and what you already kind of know. You'll be assessing and evaluating operations of healthcare facilities, right? Developing and monitoring quality of care initiatives that improve those healthcare system outcomes, and compiling and evaluating data to support best clinical practices. Next slide. The curriculum for this concentration, we have 9 credits of core, which are similar The other concentration also takes these 3 courses. There are 9 credits of courses in the School of Business itself. And they come as 1.5 credits each, and they're 7 weeks long. And you're taking classes directly with the business school. And those things, project management, organized behavior, and negotiations are explored. The advanced practice role is 17 credits, and you can see we have context of healthcare for nursing leadership, resource utilization and development, program planning and evaluation, strategic management practicum, and the nursing synthesis capstone project. And those last 2 classes are both clinical practica. So while the didactic portion of either of those courses and the rest of them are online asynchronously, the clinical portions you must complete them face to face with preceptors in the field. Next slide. So the next concentration we have is nursing education. And this coursework focuses on curriculum development, theories of measurement and evaluation, and outcome-based approaches to promote relevant, safe, and efficient professional practice to improve outcomes. We're really prepared to enhance interdisciplinary learning experiences in a variety of academic and clinical settings. Next slide. You can see here we have the same 3 core courses, healthcare and health policy issues, informatics and data management, nursing research and evidence-based practice. The direct care courses enhance the curriculum development, those being advanced patho, advanced form, advanced health assessment, and genetics and genomics. Then when you get into the advanced practice role, you'll be doing assessment and evaluation and curriculum development. And the last 2 courses, teaching methods and practicum, and nursing synthesis capstone, again, are both clinical practicums which you complete in the field face-to-face with preceptors. Next slide. Okay. So we'll talk a little bit about the RN to MSN Bridge program. And that's if you've gone to a community college or a diploma school and got an associate's or diploma in nursing, but you have a bachelor's degree in another non-nursing field. With that, you can take what we call bridge courses, right? And there's 4 bridge courses that you take. They don't count towards the 35, but you complete those and you move into the MSN portion of it. And those courses the bridge courses are informatics and project development, evidence-based practice, leadership in nursing, and population global health. Population global health is really community health, and that one has a didactic and a clinical component to it, which would require you to go into the field face to face. Next slide. All right, so admission requirements. It's an online application, so it's easy. You'll send us all of your official transcripts. We can consider you with unofficial, but we can't enter you until you send in the official transcripts. We're looking for a minimum GPA of 3.0 and a current resume. License, you need to have that license in New Jersey in good standing or the eligibility to get a license in New Jersey. 2 letters of recommendation are required and a 1-page personal statement. If you're one of the students coming out of an associate's degree program into the Bridge, you will have 6 months to pass the NCLEX. Next. So we do have quite a few partnerships, and these are just a few. We are proud to partner with Hackensack Meridian Mountainside Medical Center, the Atlantic Health System, and St. Joe's Medical Center. If you are working at any of those institutions, you'll have, in addition, an additional 20% off the tuition rate. Don't forget, if you work wherever you're working, for the most part, they're going to be giving you tuition reimbursement as well. So working at these places and that extra 20% really brings the cost down. Next slide. Well, just to let you know that we are accredited. We are accredited with the CCNE and the Board of Nursing, and this slide just speaks to that. Next slide. If you have any questions, there's a number to contact us at in the email, and we'd love to speak to you further. And if you have any questions at this time, please ask. Or you can raise your hand, or you can put it in the chat.
I received one directly, Dr. Ballas.
And what is the question?
So they want to know, what kind of teaching would someone do with an MSN in nursing education?
You can be a clinical educator in a hospital or whatever healthcare setting. And with an MSN, oftentimes community colleges will hire nurses that have MSNs to teach. Of course, teaching at a higher level, you're going to need a doctor. Any other questions?
Yep. I received another about the nursing administration, wanting to know what kind of jobs a graduate could expect from that concentration.
Name them as a nurse manager of a unit, a nurse executive. We like the CNO of a facility. It's essentially administration is what it is, and they're not a bedside nurse. And a lot of students come in with experience already and use this program to get themselves a little bit further ingrained and step up the ladder in nursing administration. Depends on where you're working, how they call it, nurse managers, nursing directors, nurse executives. Anything else?
Yes, another question about the practicum courses and wanting to know if those clinical hours are similar to the clinical hours they did in their bachelor program.
No, absolutely not. The hours are far less. You're not going into the clinical area for 8 or 10, 12 hours with a instructor. It's very independent, you and the preceptor. The first one is only 60 hours and the second one is only 90 hours. And some of those hours are dedicated to you doing the research to complete projects and assignments. Anything else?
I'll just give the chat a couple more minutes to send in any questions they might have.
Yeah. So a question here from Mohammed. We are not working internationally at this time. All students must be able to work within New Jersey. That answer your question? Who is that from again, Christopher?
Um, from Mohammed in the chat.
Okay, yeah.
And I received another question about international applicants. This program cannot accept international applicants at this time. Like Dr. Vallis mentioned, you need to be a working registered nurse in the state of New Jersey for this program. Well, it looks like that's all the questions we've received. So, thank you, Dr. Vallis, for answering those. And thank you again for joining us today to learn more about the online Master of Science in Nursing degree program. A recording of the presentation will be sent to all participants in the following week. Thank you and have a great rest of your day.